Hi, my name's Phil. I like talking about politics, and in this video I'd like to take a look at the latest on the NHS as waiting lists continue to fall, reaching a 2-year low and the biggest drop for an April since 2018. But a lot of people, particularly on the right, are criticising the amount which we are set to be spending on healthcare over the next few years. But this is because the right wing created an unhealthy nation with its policies. So how did this happen and what further action do we need to deal with it? But first, for daily news and politics, please hit the subscribe button to stay notified. So there are a few things I want to discuss here. See, the lower waiting list, the budget increase for the NHS, why we need to spend so much more on healthcare and what more Labour could do to tackle the issues beyond more funding in tough economic times. So the waiting list, first of all, Labour made a lot of policy promises, but one of the few which, you can always be fairly confident about with a Labour government is making sure people get seen quickly by doctors. This is because people on the left and some on the right understand that there are just all-round benefits to having an effective and efficient health service. See, the Tories always gone about efficiency, even though they never actually deliver it. But effectiveness is necessary as well, absolutely crucial. If you see a patient, but you don't cure them, you just see them go, oh, it might be this, go away, discharge them just to get them off your list. That's sufficient, right? But it's not of any help to anyone. And why should we make sure that people get fast, effective treatment? First, because a fit and healthy public is a happy one, and only grifters don't want a happy public. But for those with a more selfish disposition, it's also an economic benefit. Children waiting for treatment will have their education disrupted, and they are the economic engines of the future. Working people cannot be at full production unless fit and healthy. So delays in treatment means we are losing out on productivity. Also, some conditions can worsen with delays, meaning less chance of ever getting back up to full productivity. If we were breeding like rabbits, the rich Tories who own our economy might not care, go back to the Victorian attitude of, well, just make it easy to sack people and get more workers. But we've got a declining birth rate and calls for tighter restrictions on immigration. Well, in that particular case, a sick worker is a hit to productivity no matter what your labour laws are like, because you've got a limited amount of labour. As for older people, even if not economically active, delays in treatment means more expensive treatment in the end. It's just cheaper to make sure people get diagnosed and treated quickly than it is to starve the health service of resources. So the government announcing that waiting lists continue to fall, very good news. Remember how Rishi Sunak promised to get an NHS waiting list down, then they actually went up? Yeah, that's because instead of actually doing anything to reduce them, he actually just made it harder for the NHS to treat people. I agree to get NHS waiting lists down by making it harder for the NHS to treat people. What do you mean the NHS waiting lists have gone up? How did that happen? Now we have a government that don't just promise to reduce waiting lists, but actually have done so. And this is before. Remember, this is before the investments which the department will be announcing after the spending review. Labour haven't actually begun the major work yet. Which brings me on to the funding. So the right wing are complaining that new analysis suggests that by the end of the decade, we will be spending pretty much half of all public spending on healthcare and social care. The right wing are interpreting this as excessive spending on healthcare. But frankly, until we get the results that Labour were getting last time they were in power, I think most people will think we're not spending enough. Also, the 49% spent on the NHS and social care by 2030, that's not just a reflection of how much more we're spending on those things, but also how little we're able to spend on other things. Because the bottom line is the Tories shrunk the economy whilst in power. When you take inflation into account, the economy, as of last summer, with the general election when the Tories left power, was much smaller than when they picked it up in 2010. They frittered away over a decade of low interest rates, which could have been used to borrow cheaply for investment in the UK. They didn't. They let everything fester and decay. Now Labour are having to do what they can to catch up with a smaller economy, an already squeezed public, political trust at an all-time low. So you try saying, we've got this plan, but it'll take 10 years. Can you give us the time to do it? The public would go, no, we're sick of giving people time. And a much higher cost of borrowing. And if we focus in on the NHS, because I'm not entirely sure what the long-term plan for social care is right now, the reason why healthcare is having to do such a lot of heavy lifting is down to numerous policies which have made the nation way less healthy. Let's go a few of the major ones. Now, not all of these are the fault of the Tories alone. Labour have joint responsibility for some as well. But first, although we took action decades ago to tackle smoking from a public health angle, what are we doing about ultra-processed foods? Nothing. Part of the problem is a trap in that you can't just ban them because it would be stunningly unpopular for lots of reasons. It's not easy to just tax the shit out of them because ready meals can sometimes be the cheapest way for people on low incomes to eat. Though I would say you could apply a poisonous as shit tax on any ultra-processed foods which are clearly not part of a main meal, like Pringles or something, right? We should also run public health information campaigns to at least help those who can afford to do so make better choices. Next, we have the extreme Tory Brexit. It reduced the availability of fresh food, raising prices, driving even more people into lower quality, sometimes dangerously unhealthy options. It's made a global cost of living problem into a crisis by reducing the incomes of millions of people, at the same time as seeing very high levels of food inflation. So incredibly unhealthy foods are cheap, healthy foods more expensive. What do MPs think is going to happen? Third would be the way we dealt with COVID, though it'd be more accurate to say the way we didn't deal with it. The Tories' collapse of NHS services meant it could not cope with the sudden influx of emergency cases. We know that the government shoved elderly patients into care homes without a negative test, which then allowed the virus to spread like a wildfire. We also didn't get PPE to frontline health and social care staff quickly enough because they would come up with this stunning wheeze to throw a load of money at their mates, right? We now have goodness knows how many people, including hundreds of thousands of frontline health and social care workers, suffering from long COVID. And then governments are moaning, oh, we've got this big chunk of people that were economically active and now they're not. What's going on? Why aren't they back at work? Because they're ill. We didn't stamp down hard enough on flare-ups, so we ended up being in lockdown for excessive periods of time, leading to more mental health problems, especially for the young. Just simple actions like putting air filters into classrooms and offices would have massively cut down infections. And this is something we're still not doing. So even though Labour are taking healthcare much more seriously, they're still not acting to prevent infections as well as they could. And mental health problems are also made worse during a cost of living crisis, where people are worried about just getting by. And when there's almost no provision to treat it on the NHS, the problem just gets worse. And these are just the big domestic issues. There are also more global ones like extreme heat from climate change, creating a lot of medical emergencies as well, particularly for poorer, more vulnerable people. Which of course means if your other policies increase the number of people who are poor and vulnerable, more people will need medical help for the effects of extreme heat. Bad policies all feed into one another to make the cumulative effect way worse. As for social care, well, we have an ageing population. Raise the pension age as much as you like. Workers are naturally going to be less productive and require more support as they age. So, of course, the financial demands on health and social care are increasing all the time. You can't just say we've raised the state pension age. You've got to be fit and healthy for another year longer. Well, biology says otherwise. The only way of reducing this would be, I suppose, the following policies. First, quicker and more effective diagnosis and treatment, especially for women who face years of delays for anything that isn't an issue for men. Parliamentary reports have been pointing this one out for years. Second, higher taxes on shit food and use the money to subsidise healthier options for low earners. Third, public information campaigns on the link between certain foods and illnesses, as well as certain other foods and health benefits. The argument against here, I suppose, is it will hit jobs in the shit food industry, but you can't have it both ways. If you want people eating junk food, then cough up the money for treatment. If you want a leaner health service, take action against unhealthy habits. And on the social care front, well, couple of options. Either adopt Cybermen technology to replace knackered body parts or adopt a Logan's Run type solution if you want to keep the cost down. Neither is likely to be a vote winner. But let me know what you think in the comments below, and for more content you could subscribe to the channel or join for access to streams and behind the scenes updates. Thanks for watching, and until next time, I'll see you later.